Hi nurses, we're back, and the topic for discussion today, I specially put together a series of videos called The New Nurse Over Morning Coffee. Reason for this is we all know at some point we are going to be called a new nurse or have been called a new nurse. And it takes time really to get to that point where you feel very confident when you work doing exactly what you're doing, to feel that you can challenge a situation in the clinical setting without always having to feel that you have to call on someone, or maybe feeling very down when you get home that you made the wrong decision. So this special appeal is for the new nurse, and typically people discuss their problems over morning coffee. So I called it The New Nurse Over Morning Coffee. Here are two nurses. How do you like your new floor, Anne? The response is, I do not know what to do when my co-worker had to help with a code blue. She didn't know what to do. Well, it's a difficult situation when a code blue is called. Typically what happens, a code blue is called and a nurse is called away. And that means whoever is left on the floor is going to take responsibility for the rest of the patients. Sometimes people communicate it and sometimes they don't, and you're stuck. So here are a few helpful suggestions. Well, here's another situation Anne got herself into. Nurse, my arm is red and swollen around my IV site. A patient calls, and the nurse is of the code blue. What does she say? Your nurse is busy. When she returns, I will let her know. This actually is not the way to be handling something like that. What would be appropriate for this nurse is to take the trouble to assess the IV site, and then it would even be better, even before getting that far, if she would have familiarized herself with the institution's policies and procedures as what to do if there is a code blue and other people get called away, because it does happen. Emergencies happen. Sometimes a patient might fall on the floor, everyone rushes off to help, and other nurses are left behind, have to take over the rest of the unit. So it pays to ask someone more experienced or familiarize yourself with the policies so that you may always be on the right track when making decisions. Well, the IV is infiltrated, and it's not such a great idea to leave an infiltrated IV running. It's going to do a lot of damage to the soft tissue around the patient's IV site. Well, what is a code blue? A code blue is cardiopulmonary resuscitation or cardiopulmonary arrest. I'm sorry, I wrote it twice, arrest. This calls for teamwork, and it's not really the sort of situation, well, typically most nurses know that almost every situation we find ourselves in, we need someone's help. And there are some videos that might be of great help to you. One's called The New Nurse ICU, Imagine Being in This Situation. Another one is Patient CPR, and these can be found at dearnurses.org. These are specially designed to help the new nurse with organizational skills in the clinical setting. And it goes without saying you need to familiarize yourself with your institution's policies and procedures. What happens when there's a code blue? Who takes the chain of command? Who helps out with what, to be certain that you're doing the right thing? And here we have another situation, another new nurse. She is very upset. She was sent to work in PACU, and she had no idea what was going on when she got there. Well, what if you were put in that situation? We've also got other videos that might be of help to you on YouTube. Sessions 16, 17, and 18, EKG Reading. It talks about the basics of EKG reading, from what the P wave means, what to look for, normal versus abnormal, a P wave, what the QRS signifies, what the T wave means, how you can spot if you're in that position. If there is no P wave, something is definitively wrong with the EKG. If there's only a QRS, or if the QRS and the P are missing, then there are some very definitive problems. So take the time to go and look at session 16, and you may want to read 17 and 18 as well. A little more complicated, but at least you'll have some idea about the basics of EKG reading. And it'll make it easier for you when you get floated to an area where nurses need to know about EKG reading. And I also wanted to point out to you another situation about, in case you have never been in what is called a code blue. We said that a code blue is cardiopulmonary resuscitation when a patient cardiac arrest, and there are very grave responsibilities. So over morning coffee, that's special appeal for the new nurse. Here is the new nurse standing on the left near holding on to the ventilator and saying, I'm just going to stand here and watch. Really, that's not acceptable. Remember this, it's never easy to predict when an emergency can happen, but it is easy to learn what to do when things go wrong. You can always confer with other nurses, what do I do if there is a code? Sometimes you may not be able to shock a patient because you don't have ACLS, you're not an ACLS person, but you might be able to get an IV bag, you might be able to write down what drugs are given, or you might be able to get a trash can and put near, everybody can throw things in it so they don't go tripping over the old stuff. There's always something that you can do to be of service. So, or you might just be able to pick up those EKG strips and put them on the appropriate sheets. So I hope you've enjoyed learning. I hope you've gathered something from this, and have a great day. And this is just going to be part 1